Hi everyone, it's Dr. Selene with BU Medical. I want to talk to you guys about Botox. It's one of our most commonly used medications. It's a beautiful medication that helps stop wrinkles from forming or getting any deeper. The most typical areas that we use it are in between the brows, around the eyes, and the forehead. So the areas that we treat are those primarily. The company recommends around 64 units just for those areas alone. So 20 units in between the brow, 20 units for the forehead, 12 units for this eye, and 12 units for this eye. Do we always use those doses? No, we can always go a little bit less on them, but just know that the company says that the duration of this medication will last 3 to 4 months. And if you're not going to those standard recommended dosing, you might not get the duration. So if somebody comes in and says, I just want to try it for the very first time, I'm nervous about it, they may start with 10 and 10. Just know that that's a half dose, so you may not get the 3 to 4 months out of it, and you probably won't, and that's okay. As long as we have an agreement that, hey, we're gonna start lightly, it's not the recommended dose, so you probably are not gonna get the duration that the company says you will get out of it. And then sometimes people even need higher doses than that to get more duration out of it. Why does it wear off? It depends on your metabolism, it depends on your expression, it depends on how used to your body is. At this point for me, I don't do Botox very often, but I feel like my muscles are very calmed down at this point. They're trained up. They've been doing it for the past decade, and so they know not to make this wrinkle or that wrinkle because we haven't done it in the last 10 years. And so Botox has been around for a little while, not as long as many people think. It was actually FDA approved in the early 2000s. So it's not something that's been around forever, but it is something that's really widely used. It's actually the most common non-surgical cosmetic procedure that there is. And it's a great way to dip your toe in the water if you're curious about anything when it's in regards to aesthetic medicine. Oftentimes what we recommend is starting with the center of in between the brows, the one that gives you that resting bitch face or that angry face. And then you might want to be cautiously proceed into the forehead lines. That one gets a little tricky because it goes all across the forehead. If you've seen some movie stars that you think, wow, that looks really funky with a Spock brow or one side's higher than the other, it's because the forehead is a little trickier. So if you want to be certain that it's going to be an easy result, it's often in between the brows and maybe a little around the crow's feet. So you can do the forehead, it's a beautiful result. We often recommend the two hand in hand because once this is relaxed, this is gonna start bothering you. And then the crow's feet are just kind of an added benefit. Those don't totally go away is the one thing I always tell people. I have made them significantly improve in people that I've done 20 to 40 units a side. And it depends on how much you recruit your muscles there, of course, as well. But like I said, the company recommends 12 and 12. I think it's a beautiful treatment at that dose, but I will say they don't entirely go away at that dose. And I always say you probably don't want them to entirely go away anyway. As I've gotten older, I have liked the more relaxed look, but I also don't like that glossy, you can ice skate on my forehead look. So I actually want to show expression, I want to show concern, and I want to be able to have a lively face. And I think most people do. And so it's a case-by-case basis how many units you're gonna need, and usually your provider can guide you in that, and they can say, hey, this is my recommendation, this is what the company recommends, and let's meet kind of where you're comfortable. That can be budget related for you. Some people will sell Botox based on the area, and some people will sell Botox based on the number of units. We personally do it by the units because not everybody's created equal. So for me, I don't have very much movement, but you can see right now I'm trying to move it. And so I would say for me, because I don't have very much movement, I might just start with 10 units. But let's say I have a really busy lifestyle and I say, I can't go in, I don't want to be coming in regularly. And I say, I only want to come in 2 or 3 times a year, then fully load me up. So that would mean 20 units in here and 20 units in here, and then the 12 and 12. So that's for me because I have access to it. I can do small doses more regularly. So if I see something's acting a little funny, I can just do a little tweak on myself. Most people are busy with busy lifestyles. So I always say, go for the gusto, go near the recommended doses if you want to get the duration out of it. Keep in mind that some people that are runners or very active in lifestyle, they might need more or will run through it more quickly. Remember, if you're going to a reputable place, it's getting formulated. When we get Botox, it actually comes on dry ice and it comes in a dried capsule. essentially. And what we have to do is we need to formulate it, add some normal saline to it to formulate it to make it a liquid form that then we can inject into the muscle. Again, if you're going to a reputable place, that should never be diluted. Keep in mind that you would make a lot more money if you were to dilute a bottle of Botox. So let's say a bottle of Botox which has 100 units and you were to add a little bit of extra water to it, then it could suddenly go from 100 to 120, 150 units. But you're not going to get the results, and in my opinion, very unethical. So unless you are communicating that with the client and saying, hey, we're going to microtox or do a unique way, and you're changing the price based on that. That's rare though. So if you're going to a reputable place, it should be formulated to company standards or a way that's consistent, that you know if you're getting 20 units, you're getting 20 units. You're not actually getting 15 units. So you always want to make sure you're going to a reputable place that does it frequently. There are some negative side effects from this. They are rare. They have happened to me, and I will say that if you're going to a provider who does this enough, they should and probably will have had an adverse event. And so that can be a dropped brow or a heavy brow. It could be where you get a little heavy in the middle of the eye. It could be where the eye covers altogether. Those have been rare and they're not very common, but they do happen. So keep that in mind, that this is not a no side effect profile medication. You do want to go to somebody who knows what they're doing. If it's a simple little Spock brow that's acting up on the side, that's really easy to tweak. So we don't want to go around or have you go around thinking, oh, well, I'll just live with it and we'll fix it the next time. That's super easy to fix, so go back. If you got absolutely no results, that's also a good reason to let your provider know in case there's a resistance issue, or if you're just not reacting to it, or maybe the doses was totally wrong, or maybe it wasn't injected in the muscle. So it has to be injected into the muscle in order for it to work. Remember, it's those muscles that are contracting that's causing that line or that wrinkle to happen. So in essence, what Botox is doing is it's going into the muscle, relaxing the muscle, so the muscle isn't pulling, and that in turn relaxes the wrinkle. As you continue to relax the wrinkle and get it to chill out, that's when those wrinkles can essentially go away if you get it early enough. When I was in my early 20s, I remember I was at UCSF and I asked one of my derms locally to inject me with Botox, and she said, absolutely not. But nowadays, we actually do believe in preventative Botox. And so we always say the best wrinkle is the one you never form. So if you see some movie stars that actually look good with aging, they probably have done some Botox early on. And it's not just olive oil. Sorry, J-Lo. But it's actually some supplementation. She may not have done Botox, but there probably are other things that she's supplemented with to help her look amazing, which she does. But for us, I will say Botox is a great start to going into your aesthetic medicine journey. We believe in it, it works. It's something that people will spend thousands of dollars at Sephora on some cream that you're never gonna get these type of results with. So keep that in mind when you're budgeting. It may sound like a lot of money. I would say the average person probably spends $250 anywhere to $650. So it's a big range. And it depends on where you're going and what area of the country you live in and the price point there. But it's a worthwhile investment. Remember, most people only do this about 2 to 4 times a year. So it's not something that you're doing all the time, but when you split it up on a monthly basis, it's actually worth it. What you're saving in other things that you're trying to get rid of, it's so much better. And we want to get these wrinkles before they get in too deep. So these are the basic 101s on Botox. We love it, we believe in it. Come get it, go to your local provider, make sure they're reputable. And I hope that's helpful to you guys. Remember, we want you guys to look great so you can feel great, so you can do great things in this world. Take care, guys. Bye.